amazing. Katie, Claire Louise, you have two kids with ADHD and one who has Asperger's and tics. That sounds like a full plate. Um, Diane, you recommend the magazine. Fantastic. All right, so let's get started. So it would be really great if you write in your questions in the chat section so I can directly help those of you who would like some personal help. And I'm going to start with some of the questions that have been submitted to us that are on the Facebook page and that were submitted during the webinar on Tuesday to Mary D. Sklar but weren't able to be answered. So I'm going to start actually with the webinar questions because one thing that struck me is that there were some kids on that webinar, middle schoolers and a 9-year-old. And one of them said, "Hi, yeah, I need help. How do I take action in trying to help with my possible ADHD, ADD? I don't know if my parents already know or not. I'm not even sure they can already know. Maybe they just figured it out. My point is, I don't know how to know. I've tried implying that I might have it by saying I've been researching ADHD recently, and it turns out I have a lot of the symptoms. I have all that I've actually found, actually. Mom just replied, yeah, that happens. Also, my older sister and my older sibling, they, them, had a lot in common with her friend. Mom replied to that with, yeah, ADHD. Am I right? What am I supposed to do? In all capital letters. Similar comment from a 9-year-old and a 13-year-old. So I don't know if you are listening out there, teens and tweens. I know that at Attitude, Attitude and I have been talking about doing one of these Facebook Lives for teens and tweens, and I think we're going to schedule that soon. But here's what I want to say. If you think you have ADHD, and you're a teen or tween, I would ask your mom if you could talk to your pediatrician or your doctor and ask to talk to them alone. That's okay. You know, kids often want to say something private to their doctors. Of course, your parents will have a release to speak to your doctor. But I think if you could talk to your doctor first about your concerns, then you would have someone to assist you in the conversation with your parents. Because I'm getting the sense from the comments that I read that people were scared to tell their parents and that their parents weren't taking them seriously. So I want to encourage you, to do that by talking to your pediatrician first, and you can just say tell your parents, you know, there's something that's going on that I want to talk to my doctor about my attention. Could you please make an appointment? And even if they say, what is it? What do I want to know? You say, you know, I just want to ask them myself. I'm in middle school now, or I have some questions. And that's okay. I think most parents would understand that you want to talk to your doctor by yourself. Here's another question that was a good one. My son has a hard time focusing, especially when he has to do homework. He blasts music all the time. I tell him to turn it off, but he says it helps. How could it? We fight all the time about this. Does it help? Should I let him listen? My answer to that is a resounding yes. For a lot of kids with ADHD, there's a certain zzz that's going on in their brains, and the music kind of fills that space, and it does allow them to concentrate. The music can take away some of that distracted energy so that they can focus on the task at hand. If, however, you don't want to listen to that music, then I would encourage the use of headphones. But make sure you can walk by their computer periodically to see that actually they're doing their work while they're listening to music, or put the music on a different device. Let's get to some of your questions. Hello from Oklahoma. Um, Caroline says her son says the same thing. Yes. So Claire has a question. My daughter is nearly 17 and you have some some shortened abbreviations in your comment which I don't understand. So could you reframe that question without the ACED and the GCSES because I don't know what those are. Thank you so much. Okay. Let's see. Let's see if there's any other questions. Um, okay. So I'm going to go to some of the questions from last time. My son, who started sixth grade this year, is struggling with all areas of executive functioning. While we are working on tracking assignments and time management, he is struggling with impulse control and handling his emotions. He becomes overwhelmed very quickly when it comes to difficult situations with peers and teachers, teasing, demands, etc., which lead to negative thoughts about himself. The administration wants to help however they can. How can I best relay information about his executive function and emotional difficulties with his school? So this is a fantastic question, because what I love about this question is it's how do I collaborate with the school rather than coming to the school from an oppositional perspective. So I think when parents can work with the school as much as possible, the outcome is the best it could possibly be. So you're working on tracking assignments and time management. That's great. Impulse control and handling his emotions is something that's going to happen with time and redirection. And so when he is overwhelmed with difficult situations, what are the signals to him that he's starting to get overwhelmed rather than when he's overwhelmed all of a sudden and boom, you can't actually do anything about it. So we want to try to help him and his teachers identify when they notice that he might be activated inside. This being able to check in with him regularly would be another thing that would be helpful. Perhaps a teacher or two could check in with him throughout the day, particularly if it's online school. That personal touch can make a big difference to kids. The other thing that I would encourage you to do is to figure out how you could have direct email contact with someone at the school who would relay the messages, or just have an group that you set up with his teachers so you could let him know what you're doing and hear what they're doing. This kind of collaboration is essential for kids because when they get the messages in these two primary areas of their lives, at home and at school, those messages are more likely to sink in because it's repetition, repetition, direct instruction to learn executive functioning skills. Okay, Claire asks, you're concerned as both kids have it. Could this come from me? I never thought about it now, but now that I do. So Claire, it doesn't really, I mean, I guess it matters. It's good to know if you think you have ADHD. And there are some great articles on the website about women with ADHD and how to identify if you think you have ADHD. Um, I think, Claire, what you're saying is that your daughter is nearly 17 and she is moving on to her A-level tests. Sorry, it took me a little while to catch that. And once has come off her meds, which worries you. So one of the challenges with teenagers is that they want to have more control about their medication. So they'll put themselves on or take themselves off as they see it's necessary. I would sit down with your daughter and her prescriber and talk about the times when the medication is most helpful and needed for her, times when she's concentrating, when she's preparing or taking a test, and times when she doesn't have to take it, because perhaps she needs a break on the weekends. And so if you could set up some sort of routine about it, I'd also point out that she's done well before when she was taking the medication, and this might not be the best time to stop taking it, particularly when she has these very significant exams coming up. Annie asks, how can I help my daughter, age 11, in sixth grade, advocate for herself by using chat and unmuting to ask a question when remote? This is a terrific question. A lot of kids who are alternative learners feel embarrassed that they struggle. They don't want to ask their question because everyone will see that they don't understand. And where in school they might be able to pass a note or stay after and just say something to the teacher. And so what I think I'd want to talk to her about is her fear around unmuting or chatting. What is she afraid that people will think about her? And what types of questions would be okay to ask? What does she notice other kids are asking that she herself might feel comfortable asking? I'd also try to set up with the school a time where she actually can ask any question she wants in some sort of remote support session. Some teachers have when kids went to school, they had after school time, and kids could stay after and ask questions. What does that look like now in your school, and how can you set that up for your daughter? John says, as an adult with ADHD, I find it helpful to find a distraction from my monkey mind. When I am doing things that are important but out of my interest zone, music can be one of those things. I agree. I think music is great for that monkey mind. Claire is saying again, my daughter's done brilliantly on her exams. She's now into her next level of college schooling and has come off her medication. Okay, I see. So I'm going to stick with what I said, Claire, the same thing. So she's in college and she's trying to assert her independence, but the thing that has helped her do so well in school has been being on her medication. So could you come up with a schedule that makes sense for her so she would have the medication in her brain to focus when she needs it and maybe not have it or when there's not an academic situation or pressure. Rhonda, my son is doing the hybrid school program, half learning at school and half learning at home. He has a hard time staying on task here at home when he should be listening to his teacher online. Ideas. Well, I think one of the challenges is that online school is just not that interesting or engaging for many kids. And what would help is if you could break down the times when he has to be online. He might need more movement breaks or what I like to say brain breaks than he did when he's in school in person. So if he's struggling with being on task, we want to look at the situation when the task is occurring, the length of the task, and what's that task sandwiched in between. It's because every one of those factors might need to be tweaked to assist him in his concentration. Another thing you might want to do is have the teacher ask him specific questions throughout the period so that he knows that staying engaged is not only important in terms of learning, but just in case he is asked a question, he'll be present if he can. Hi, Lulu. Oh, thank you. I appreciate that. Diane says, something about the parent that track productivity for a few days with music and without, even with different types of music. You might be surprised. Absolutely. Jenny says, my 8th grade son seems friendly with kids at school, but doesn't have real friends. He tries to constantly chat with people online that he doesn't even know. 8th grade boys, what I want to say is, oy vey. Socially, 8th grade is a tough year for boys. 7th grade, a little bit less in the United States, particularly if it's more of a transition year. There's often more independence. 8th grade, a lot of boys struggle during this year. And so he wants to have friends, but he's not sure how. One of the challenges for kids with ADHD is they're not sure exactly how to engage other kids. They want to engage other kids, but they struggle with what to say and how. I would encourage you perhaps to have a couple practice conversations, not only about what to say, but to whom. Who are in some of his classes that he's friendly with? What's one or two people that he might be able to reach out for a Google chat who he knows? Because when he reaches out to people he doesn't know, who might be popular kids or kids who other kids know, and he's trying to do the, I know you, so maybe you know them, so maybe I can know them, he's probably not going to be as successful. We want right now, what we want for kids, particularly those 8th grade boys, is to have some social successes. I'm not saying 8th grade girls have it any easier, by the way. That's a separate question, of course. So we want him to have some social successes, and the way we're going to help him have some social successes is for him to practice. What does that mean? Who would be some people specifically? While it's still nice out, could you come over and shoot some basketball? Or just again reaching out on Google Hangout to people he knows. That's often scarier because if they reject him, he feels like he has to face them. But in reality, the chances of being accepted by people he knows are much greater. Dave. I have conversations with my wife that I can't remember. How do I help my memory with ADHD to sink in? Dave, the best thing is to get a pencil and a pad of paper or a Post-it and write down the things that you talk about so you can refer to them later. So many of my clients who are adults who live successfully with ADHD carry around a small notepad, or they write the notes on their phone so they always know where it is, because people always know where their phone is, so that they can refer back to them and have a place that triggers their memory. One of the challenges with working memory is it only holds about 4 to 7 units of information at a time. And if you're having a conversation with your wife and you're not writing down what you're agreeing on or what's important, then your memory's going to you're going to have to rely solely on your memory to grab those chunks at different moments. And that's going to be frustrating for you and for her. So my advice is to take some notes and let her know that's what you're doing, not playing a game on your phone. Diane has a question. Diane, my daughter has been diagnosed with ADD, ADHD in the 5th grade, but later determined to have an anxiety disorder. Please talk about this because it matters for appropriate therapies. So, ADHD rarely travels alone, and a lot of times symptoms of ADHD can look like anxiety, and symptoms of anxiety can look like ADHD. In your situation, I'd be curious about what the diagnostic process was. Sometimes people will be diagnosed with ADHD, and it might be that they have a coexisting anxiety disorder, and that anxiety disorder is the dominant diagnostic category, and the ADHD is second. It's more mild. So we want to figure out what the diagnostic process is. Have they had a full assessment, or is it just rating scales? Because that's very different. So why don't you respond back and then I can give you a more thorough answer. Melissa, my son is in 5th grade and overall is a pretty happy kid. Thumbs up to that, Melissa. However, he has a difficult time with unplanned situations, such as today was pajama day at school. I left out his clothes only to get a call from my husband that he had grown out of his PJs. I'm sure he had a meltdown about that. So he couldn't participate and wore regular clothes to school. I got a call from school saying my son hates pajama day and wants to kill himself. How should I approach the discussion on communicating feelings more appropriately? Well, this sounds like just a very unfortunate situation all the way around. I mean, it's not your fault that he outgrew your pajamas, nor is it his. And it's very difficult to go to school when you're not participating in an activity that's everyone else is participating in. Unfortunately, he wasn't able to pull something together that looked like pajamas, like sweatpants and a t-shirt or something, which would have probably helped him. So my guess is that he hated pajama day because he didn't fit in. He may hate pajama day anyway, but particularly today because he didn't fit in, and wants to kill himself because he's so ashamed. He's mortified. And he doesn't know how to process that. He doesn't know what language to put on that. That's one of the challenges we have as humans, is attaching language to our feelings. He feels terrible. He doesn't know what to do. He's desperate. He says he wants to kill himself. He doesn't actually want to kill himself, most likely. He just wants to be removed from this really unpleasant, unmanageable situation. So I think it's worth having a conversation to him about what kinds of things he can say when he's that miserable. Like, what is a phrase he could say instead of "I want to kill myself," or "I hate myself," or "I hate my life"? All of which are valid feelings, but they're not which he may very well be experiencing. Um, and it's okay to say, "I hate this. I hate myself," but it might be more effective to say, "I'm really embarrassed that I don't have pajamas and I don't want to be in school anymore." That's probably more accurate. And for a 5th grader, we want to remember that the ADHD brain matures more slowly. So what we're looking at is someone whose brain is actually more like a 2nd grader. And in those cases, when they are stressed out to that level, it's just going to be, a desperate kind of verbal, it's verbal display, so to speak. So I think just saying, when you say you want to kill yourself, it's really, I wonder, is that really how you felt? Or were you feeling this? How could we come up with some things that you could say during this time? And then to let the school know that he has some phrases. Here's what they are. please, if he seems unhappy or desperate, remind him of some of the things. Write them down. Maybe send them to school. Have him put him in his desk. A lot of times for kids with ADHD, they just cannot recall what to say. Hi, Ada from Iceland. Great. Um, you were diagnosed last year at 34. I was told that getting a diagnosis wouldn't be any good for me. I was in therapy for depression and anxiety. I know that RSD isn't medically recognized as a symptom of ADHD, but many relate to it that have it. Do you know if there's research happening on that? I'd also like to see emotional dysregulation and RSD more in the discussion about ADHD. So I believe that there is a lot of information on attitude.com, attitudemag.com about RSD, and I encourage you to check out those pages. I think there is research that's happening, and I think it is well accepted in the field that RSD does often accompany ADHD. Um, Jillian says, I find my ADHD is directly in connection with my anxiety. When I am not on my medication, I'm easily overwhelmed, frustrated. I don't get things accomplished and shut down. My brain is going all over the place. That's exactly right. And so the challenge for people who have ADHD and anxiety is, can the medication assist you in lowering your anxiety? And which medication is appropriate to do that? And or would you also benefit from a selective serotonin reuptake inhibitor or something that would target the anxiety directly? And RSD has been found to be related to anxiety as well. Mandy, can you talk a little bit about ADHD and ODD diagnosed together and what that can look like for remote learning? Well, that's a really good question, Mandy. I think it's something, close to 40% of kids with ADHD have been diagnosed with oppositional defiant disorder. And so they travel a lot together. And when kids who have ODD are properly medicated and are receiving treatment, parent education, as well as family work, they can be their symptoms of ODD can really reduce, in some cases disappear within 2 years. For remote learning, what this looks like for ODD is a lot of aggression, anger, and refusal to participate. And that's really hard because kids need to go to school, and they probably want to go to school. They're probably desperate to actually be in school. It's just that online isn't working for them. So I think in these cases, when a child has ADHD and ODD and is struggling with remote learning, it's very important that you set up a meeting with the school and lean on the school a little bit to help you manage and set up a learning program that works better for your son, or your daughter, whoever it is. Whatever the situation isn't working for them. And that might mean that they need more breaks. It might mean that the expectations of academic performance are shifted. It also might mean that they maybe do some remote school, and when they're doing their work, they turn off their computer and just do their work separately, maybe with you around, or maybe in the presence of a loving relative who may be retired, a grandparent perhaps, or an aunt or uncle. I think the one thing that I want to say is that it's very important for parents of kids who have ADD and ODD to be very, very, very clear, crystal clear about the limits and the boundaries. What are you expecting? How are you expecting it? What does it look like? And include them in the process. What do they expect? What do they want it to look like? How do they want it to feel? At some point, there's going to be some overlap between the two of you, and that's where you want to start setting up your program. Amanda asks, my 9-year-old son has been on Adderall. I feel the more it builds up in his system, the less he eats and sleeps. Is there a better way to find out what meds work other than trial and error? Sadly, the answer is no. I wish there were. I wish I had become a psychiatrist so I could do research in this area. I mean, people have been doing research in this area for a very long time, and it's just not, there is no way. There are some tests that people, the saliva test, that's a pretty costly test. There are some other tests that people can do, blood tests. They're not consistently statistically reliable, which is why I'm not bringing that up. Family history is useful, and sometimes Adderall. If there are different levels of medication. So there are two strains of medication. There's the methylphenidate class and the dexedrine salts. Class and Adderall's in the dexedrine class, and there are different delivery systems, and so sometimes I've noticed in my practice for people who kind of flatten out on Adderall or are having a lot of side effects, that if they try Vyvanse, those side effects subside significantly. Shelley, my 10-year-old with ADHD refuses to wear anything but pajamas. I think your child should meet the other child who needed pajamas. I'm laughing, but it's not funny. So I hope you're just seeing the humor in that. It's a pajama day, clearly. He dislikes boxers, so he just wears without. Any suggestion on how to get him to wear clothing? So my question, Shelley, is he going to school and does he need to put clothing on? And if he isn't going to school, does it matter that he's not wearing clothing at home? Could he have pajama clothing? So he changes out of his pajamas into the pajama type clothing that he likes to wear. Oftentimes, what I see with kids with ADHD is they get a certain idea in their head about clothing. I like this, I don't like that. I want this, I don't want that. And that shifts over time. They outgrow that. The more that you engage in conflict around this, however, the harder they'll hold on and the longer they'll hold on. So I would encourage you um, to try to work with him and say, okay, these will be your sleep pajamas, these are your day pajamas. And if he can get pajamas that look somewhat like clothes, that's fine. I mean, if eventually if he's going to school and he's wearing his semi pajamas, he's going to want to change that. In terms of not wearing underwear, that's a personal thing. He may not like underwear because he may not like the constriction. A lot of 10 to 20% of kids with ADHD have sensory sensitivity, excuse me. So he may not like the tag, he may not like the feeling. What's going on that he doesn't want to wear boxers? And are there other types of boxers that might feel better? Things that hug his skin, or because it's maybe the looseness or the bunching up that he doesn't like. Let's try to get some information from him about that, and it might give you some more answers. Gianna says, my 11-year-old son's medicine makes him feel tired and his spirit seems a bit depressed or down. He is also cranky. He definitely needs the medication for school because he is a mess without it. Is this common? His pediatrician is not concerned. So, yes, sometimes medication can be flattening to some kids. If the medication is helping him focus, that's great. If his pediatrician, who's the prescriber, is not concerned, I think that I would follow his advice and perhaps, if you're concerned, get a second opinion. Debbie asks, what is the best medication to help my 7-year-old with ADHD to help with impulsiveness and emotional behavior? I think it really depends on your child, and that's a question to ask your provider. Again, people usually start with, some sort of methylphenidate or some type of Adderall in the beginning to see which has a better effect, and then they continue in that class of drugs or switch out of them. Alex asks, any innovative things I should look into, like Nemechek protocol and the Feingold diet, any value to following either? I'm not an expert in that area. I do know that there's a great article, there's lots of articles in in Attitude magazine about ADHD and food and supplements. So I'd encourage you to check those out. Katie, I am contacting our doctor's office to try to get my daughter tested. I've heard that they give you a survey to fill out and one for the teacher to fill out, but given that we are doing school remotely, how do we show that it's a problem, given that her teacher is not seeing her in person? Katie, this is a great question. I would assume that her teacher is seeing her remotely. And is the teacher noticing that there are some challenges? And there's a difference between filling out a rating scale, which is what a lot of doctors start with, and having a full battery of tests. The full battery of tests is a psychoeducational evaluation that gives you a lot more information than you're going to get from filling out some rating scales. Rating scales can be helpful, particularly if ADHD runs in the family and you're comfortable with it. But if you want more information about how your child's brain actually works and where their strengths and challenges are and how they're doing academically compared to peers, then I would encourage you to get a psychoeducational evaluation. If you live in the United States, you request this through the public schools in your district. Schools are mandated to test kids. I don't know how your district is doing that right now. In my district here, they are testing kids in person. Haley says, when seeking a diagnosis for my 5-year-old daughter and asked by professionals, why do I want a diagnosis? What should I say? She behaves totally different at home to school, which is delaying a referral, so that's frustrating. So what you might want to do, Haley, to start with is perhaps to work with a counselor who could help you with some of the behavioral challenges you're facing, and then could support you in seeking the diagnosis. Some kids do behave differently at home than in school, particularly at that young age. And so, you're not going to get rating scales that are the same in both places, but you might have some overlap. Eric, my son has problems learning in school. He compares himself to others and not being able to learn well. How can I find ways to help him learn? Thank you, Eric, for asking this question. Oh boy, those comparisons can be deadly. We all do it too. I'm not this. I wish I were that. And Erica, I'm so sorry. Erica, I apologize. We want our kids to feel good about who they are and what they're capable of doing. We want to feel that way ourselves too, right? So, I have a friend who says to me, don't compare your insides to other people's outsides. And I love that. And I think that's a great thing for us to share with our kids. Don't compare what's happening with you to what you see other people doing, your insides to their outsides. What we want to do is to help him identify something that he enjoys doing, that he's actually relatively successful at, that you can then expand in his life. So he must have some aspect of school that is okay. All we want is okay. If reading, if he likes social studies, okay, because he's interested in history, fantastic. Everybody doesn't have to be good at everything, and that's one of the greatest challenges of childhood. If you were a child, let's say those parents who are watching, if you were a child and you didn't like the beach, you didn't like the feeling of sand between your toes, but you lived in a family of 4 people, and the other 3 people really liked going to the beach, you were going to the beach, despite how much you didn't like it. You had to accommodate them, right? We do the same when you're an adult. Then you grew up, you're like, I'm never going to the beach. I hate the beach. You don't go to the beach. It's a similar situation to what we ask of our kids. I don't really like all of these subjects at the same time, but I have to perform in all of these subjects until I can go to college or community college or vocational school and specialize in what I really enjoy. So, it's important for him to have some area in his life. Maybe it's soccer, maybe it's running, where he feels that he's equal to his peers or almost equal. That will help him in some of these areas. I also want to remind you that some kids are strong academically and other kids have other strengths. They're good kinesthetically, they're good with visual spatial learning. So let's try to identify where some of his strengths are and focus on, expanding those and encourage him when you see him doing something that's hard for him and he doesn't give up, encourage him. When he's doing something that's hard for him and he does give up, encourage him anyway. I saw you stuck with that for 3 minutes. Wow. That is so much better than yesterday when you did it for 1 minute. That's progress. Oh, Shelley says he wears the same 2 pair every day. He will take out of the dirty clothes if not clean. So, what I'm going to suggest, Shelley, is you order a couple more pairs of those pajamas and don't fight it. This will change naturally. You're going to want to fight it because it seems crazy to you. But I think many of the parents online, and if this has happened to you, please say so. It's definitely happened to me. Have had kids who only like, three t-shirts and two pairs of pants, and they just would rotate all the time. That will change. So this may not be the mountain that you want to die on. Maybe pick something else. Diane, regarding ADHD and anxiety, original diagnosis was through the pediatrician with survey inventories of school teachers and parents, but my daughter's anxieties persisted. In high school, I had her in private therapy, at which point she received CBT and DBT, which helped her a lot. She's now 21 and completing a strenuous personal training certification. Exercise has been a key factor. So that's fantastic. So, not things are, everyone isn't right all the time. And so sometimes people do have a misdiagnosis, or she might have been one of the 5 to 10% of kids with ADHD who outgrow it. Sandy says, you're a parent of an 11-year-old boy who has ADHD, knowing that they function about 3 years under their age. It is best to find friends who are actually their actual age or their functioning age. Yes, a little bit of both sometimes. It depends on your child. Ideally, friends who are their age but are similarly a little bit young for their age would be great. But it's okay if he has a friend who's 10 or even a friend who's 9. That might fit him better right now. But it is good to have some friends who are your age. In my opinion, kids need two friends, one to be with and one to call on if the first friend is busy. And a lot of times, kids with ADHD feel a great deal of pressure to have a group of friends, to be popular, and they may not actually have the bandwidth to manage the intensity or diversity of those relationships. Aliana, my daughter, 43, has ADHD and is a hoarder. I worry about how this affects her children, ages 18, 13, and 9. Yes, that's a real worry because they're learning to hoard. Either they're learning how to do that as a form of compensating for something, or they're seeing that happen. They never want to do that. They throw everything away. So, I think the best thing that you can do for your grandchildren is to offer them, an alternative way of being and support if they want to clean some of their stuff and it's hard for their mother to talk about with your daughter how it might be hard for her kids or what her kids have said in the presence of the kids, but you don't want to triangulate. You don't want the kids to tell you something but then not tell their mother. It has to be an open conversation regardless of what you do. um, Okay, Nina, my fifth grader will sit and daze off during school and will blow off his teacher when he can and tells me to let things slide. How can I get him to attend to things at the moment, like get your book out, go to an app, instead of him waiting until the teacher calls him out on it? So, Nina, that's a good question. And I guess my response is a question. How much do you want to be involved in your child's school? I think one of the greatest sources of conflict right now between parents and their kids is parents' involvement in their school. And while some kids need that assistance, too much of it means you're holding it's like you're holding the whole set of worry and interest and everything about school instead of your child taking some of that on. You don't want to carry all the weight of that. So if he has to wait till his teacher calls him out, he may have done that in school regularly. You just didn't know it. So I think if he's blowing off his teacher, that's a separate issue. And in that case, you want to have a meeting with him and the teacher and you and brainstorm about that particular behavior. Raquel asks, do you recommend a gap year for college-bound students with ADHD? I think it depends on the student. In general, I think a gap year can be very useful for maturity as long as there's a purpose to the gap year and a program that your child is participating in rather than just working at CVS for the year, although that can be useful for some kids. If your child is going to be embarrassed that they're not going to college and is going to have to make up excuses, then that's something that's worth considering. Some kids need more of a transition, and they might need to do something like community college part-time and work part-time and live at home and say, I'm taking, a semi-gap year. I'm going to go to school, community college for a year and figure out what I'm interested in. They need to have something to say about what they're doing to other people. And that's where a lot of kids struggle because they already feel ashamed that they're different. So we don't want to make this another way in which they're ashamed. And there's no reason to be ashamed of taking a gap year because so many kids do it, those who are alternative learners and those who are neurotypical. Sharon says, our school district case managers are wanting an intake form to help with planning out a balanced course load for 2E kids on the cusp of ADHD. What are key questions a case manager should be gathering on students each IEP year to help with integrated planning? I mentioned a health check, sleep, nutrition, need for exercise, block course loading, and they are finally understanding a full overall is needed for a balanced load. Yes, I agree. I think that if you're planning a course load for 2E kids on the cusp of ADHD, we want to make sure that we include their attentional challenges and their underachievement. Because a lot of these kids are bright, but they can't apply what they know when they need to know it and how they should apply it. What's getting in the way of that application and what would ease that? What would enhance that for them? Pauline asks, can ADHD medication affect your brain's health long term? Not that I'm aware of. I assume you mean negatively, and my answer would be not that I'm aware of. And how soon would you know if medication is working for your child? Usually within a couple days, particularly if it's a stimulant, because it takes a day or two for the brain to sort of say, "Whoa, what is that?" And then it works on a 24-hour basis. It's in your system, and then it leaves your system within a certain amount of time. If it's a non-stimulant, that's a longer uptake period, anywhere from 2 to 4 weeks. Raquel says, what do you recommend in order to differentiate between true ADHD or an executive function disorder dysfunction? My daughter was diagnosed with ADHD based on rating scales, but what I notice are executive function difficulties. So this is a good question, and I think I may end here depending how much time we have left. So we all have executive functioning skills. There are 11 of them. And we all have executive functioning challenges, whether you have ADHD or not. I myself do not have ADHD. I grew up in a family with a brother who did. But I have some executive functioning challenges. I'm not great with my time management, not because I don't understand time, which I do. It's because I think I can do more in a given period of time than I actually can accomplish. So I underestimate how long things take. I'm working on that. It's a lifetime path. Emotional control is also not one of my highlights. I'm working on it. It's getting better. But, I come from a long line of neurotic, high-strung Jewish women, so I come by it naturally. But the rest of my executive functioning skills are really intact, and I'm able to function, very well in the world, keep track of things, organize things, et cetera, et cetera. For people who live with ADHD, it's often the reverse. They have 1, 2, maybe 3 areas of executive functioning skills that they're stronger in, and the rest are big challenges. And I would say big challenges, I'm not kidding. Like they're severely challenged in some areas. Not all, but the kinds of challenges they're facing are difficult for them in various areas of their life: school, home, work. If to be diagnosed with ADHD, it's usually 2 areas, 2 or more. So everybody who has ADHD has executive functioning challenges, often severe, and the level at which the type of ADHD that they have, whether it's mild, moderate, or severe, has to do with their executive functioning skill impairment or deficits, as I like to say. So yes, you're going to notice these executive functioning difficulties because that's what it means to have ADHD. And I will take one more question. First of all, I want to say, Lisa, that your son is 14 and lives in his pajamas, so I'm loving pajama day today, everybody. Thanks. Maybe next time I should wear my flannel PJs. And you gave up the fight unless he has to leave the house. That probably makes sense, and he has sensory issues, so that's what's comfortable. Great. Let's see. Roxanne, my 7-year-old son is in French immersion and he refuses to speak French even though he understands it. He also refuses to pronounce certain words in English correctly even after I tell him the correct way to say it. Is there something I can do to help him get over his stubbornness? So I'm assuming that your son has ADHD because you're here. And I want to remind you that a 7-year-old is actually in some ways cognitively anywhere, he's younger, sometimes as young as 4 in some of those executive functioning skill challenges, and maybe more like 5 or 6 in others. And he's bilingual. He's learning 2 languages at a time. This is going to be harder for his ADHD brain, not just in terms of the working memory challenges, but also the processing speed challenges. So, um, I don't see that this might be stubborn, and this it might be stubborn because it's a little oppositional. Like I'm not going to say it that way because you want me to, but it also might be some way in which he's, trying to assert some independence in his effort to manage all the complexity of learning 2 languages at the same time. Um, so I wouldn't get into it with him about the pronunciation. If he says something in a way that isn't the way you'd like it to, you can correct the pronunciation and he may take it or not. I would let that go right now.